she also had a normal gene. Your sister may just be she may not have inherited, it may just be something else. So you still could be tested. It's just if they test her and she's positive, they're gonna have a better chance knowing what to look at for you.
Yeah.
But if she comes back negative, you still could, because if you have a lot of ovarian at any age, and premenopausal breast cancer, that's one of the things they look at. And like I said, they're testing much, the insurances are covering it much faster, or much.
Are they?
Yeah.
We were talking about that, like for patients that have had some genetic testing or no genetic testing, and then they're HER2 negative, and we want to see if they can go on a particular medication, but we're not doing the genetic testing like we should be, because all those the family history and stuff like that. So
Well,
we've been having some difficulty. They're trying to promote that.
But
and
there are
encourage that.
other, now there's genetic testing, there's genetic testing. Okay?
There's, yes.
Okay, because there are mutations that we look for in certain cancers, like colorectal, thyroid, some others, but they're not inherited mutations. Those are those sporadic that we know that some cancers have that mutation and will there respond or not respond to certain drugs.
Is it mainly breast cancer that has the
No.
hereditary?
No, there's other.
A lot.
Pancreatic,
Colorectal has a lot.
Prostate?
Yeah.
I would say prostate.
Yeah, I don't remember all that. There
Yeah.
are, but there's more and more tests.
Yeah.
Okay.
Definitely. Good question, though. Chromosome translocations. One piece of one chromosome moves to another chromosome as cell divides. Proto-oncogenes normally on chromosome 8 and Burkitt lymphoma is on 14, so they basically move to a different spot. BCR gene on chromosome 9 fused ABL gene on 22 in CML. So they go to a place they're not really supposed to go to. Genomic instability. Cancer cells have defects in mechanisms that regulate genome replication and chromosomal segregation. Results are increased rate of genetic alterations. Genetic makeup is less stable. They don't have the stability to keep things regulatory. Hallmark of cancer cells increases pace of clonal evolution. If you want to talk about any of that, you want to look to, okay. The external factors, big one, tobacco, smokers, being around people that are smoking, the aging, certain viruses, as you can see here, and bacteria. Cigarette smoking contains more than 24 different chemicals capable of causing cancer. Cigarette smoking is the main cause of lung cancer and contributes to many other kinds of cancers. I really think too, like the vapor, people think, oh, the vapor's okay, but there's still issues with vaping. So there's many cancers that can affect from smoking: mouth, larynx, esophageal, stomach, pancreatic, kidney, and bladder. Because a number of mutations usually must occur for cancer to rise, and that's what I was talking about earlier, like some people may not even get anything. The chances of developing cancer increase as a person gets older because the time of available mutations to accumulate. The older that we get, the more chance of a mutation. For example, a 75-year-old person is 100 times more likely to develop colon cancer than a 25-year-old because people are living longer today than they did 50 or 100 years ago. They have longer exposure time to factors that may promote genetic changes that are linked to cancer. Immune system, in addition to chemicals and radiation, a few viruses also contribute to the development of cancer. In general, viruses are small infectious agents that cannot reproduce on their own, but instead enter into living cells and cause the infected cell to produce more copies of the virus. Like cells, viruses store their genetic instructions in large molecules called nucleic acids. In the case of cancer viruses, some of the viral genetic information carried in these nucleic acids, is inserted into the chromosomes of the infected cell, and this causes the cell to become malignant. It goes right in there, changes it, infects it. Viruses are not only the infectious agents that have been implicated in human cancer, The bacterium Helicobacterial pylori causes chronic low-level inflammation of the stomach lining, which in turn can cause stomach ulcers. It has been associated with development of stomach cancer. So little things like, not all of us are exposed to certain things, but there are certain things that are around us that we can be exposed to where one person, their body's able to manage that and others not. Interactions between tumor cells and surrounding normal tissues, stroma, or environment lead to tumor growth and metastasis through many pathways. Angiogenesis, TGF, or EGFR, signaling pathways, colon cancer. Those are the two for the colon cancer. Or carcinogenesis, process of initiating and promoting cancer through biological, chemical, or physical changes. Several theories are proposed. These are the theories, and they should be in your handout. I really like this slide too. I think you put this one in when you were done. So here's the normal cell. So what happens is, okay, there's something wrong, successful DNA repair. Let's fix it. We're doing what we have to do. Here, DNA damage, failure of the DNA to repair, mutations start occurring. So you can see it's a whole spiral of events that take place for it to become cancerous. And then here they tell you, this can be acquired through different environmental agents, the chemicals, radiation, or virus. I'm really bummed that these are not coming up the way I wanted. Roots of tumor spread, direct extension, local invasion, metastasis. And I'll be going into about metastasis in a little bit too. Lymphatic system carried to regional lymph nodes and more distant sites, which you're probably familiar, you'll be learning a lot of.
Mm-hmm.
Circulatory system, foul venous flow that drains the site of the neoplasm. GI tract, pancreas, and spleen, venous blood routed through portal vein of liver before entering circulation. And other common side effects, lung, bone, and CNS. That's when it gets not so fun. I know, for instance, my mother had fallopian tube cancer, and they didn't realize it, and they broke everything up to do a hysterectomy. Then they found she had fallopian tube cancer, and the concern is, while the breaking up, did that get into the circulatory system? Because that can still spread that way. So that's what people, worry about during surgeries and stuff. Even like with breast, we try to shrink it. We do the adjuvant chemotherapy to shrink it. So when they do go in to cut and to remove, you don't want to cut into any of the cancer cells if possible.
What if you do a complete mastectomy though?
Yeah, complete. Some people
They
do
don't
the.
shrink it
They,
first, right?
it depends. If it's large, they try to if you want to do repair, if you want to do surgery after for implants. If it's close to skin, they will do it. But no, if it's like way down deep and it's bigger, that's okay if you're doing a full mastectomy. But it's just if it's closer to the skin, they want to shrink it so they have more skin to salvage for the reconstruction.
Okay.
Metastasis. Normal cells will not invade or move through neighboring cells. If they do, they will undergo apoptosis, which is cell death. Metastasis, or spread of tumor cells beyond the primary location of origin, can occur in 4 specific ways. Direct invasion. Tumor cells invade nearby tissue or organs. Direct invasion of local tissue or nearby organs can result in spread of tumor throughout a cavity, such as the pelvis or abdomen. Serosal seeding. Tumors invade a body cavity, such as a peritoneal cavity, attached to an organ with the cavity. Lymphatic spread. Tumor cells spread to local or distant lymph nodes through the lymphatic drainage. Because of their migratory nature, tumor cells can also be carried by lymphatic drainage to local or distant lymph nodes. The lymph nodes serve as filters for the lymph system. Lymph fluid eventually enters the bloodstream and may carry cancer cells into the blood. Hematologic spreads. Tumor cells are carried to distant sites through blood flow. Metastatic spread of tumor cells through the bloodstream often result in recognizable patterns of metastasis. For instance, colon cancer commonly spreads to liver because normal circulation. So if you think about the circulation, the way it goes, that's where they usually spread to. How does this occur? We talked about all that. tumor terminology. Neoplasms composed of two types of tissue. I am not good at pronouncing. Parenchymal, is that right?
Parenchymal.
Oh, I'm terrible. And supportive stroma of connective tissue and blood vessels. They're identified according to tissue origin and the benign or malignant character. That's why you'll see, like down here, we'll go over that, the malignant tumors. Benign destinated by attaching oma to parenchymal. Parenchymal. I cannot say that, tissue origin. Fibrous tissue, fibroma, glandular tissue, adenoma, and you'll be hearing some of these possibly up here. Exceptions, hepatomas, hepatocellular carcinomas, lymphomas, lymphosarcoma, and melanomas, malignant melanomas.
So what's the difference between a benign and malignant?
Benign's not cancerous, correct?
Does it still divide out of control?
Well, there's the main different characteristic. A benign tumor is dividing out of control, but it's staying encapsulated.
It's contained.
And it's contained. It does not metastasize. It does not invade direct tissue. It stays with itself. It can still be life-threatening depending where it is.
If it's in the brain and you can't get to it and it
Yes.
continues to grow.
Right. So they're not benign in the sense of, oh, we don't have to
Don't
worry
worry
about
about it.
them, but they're benign in the sense of they cannot spread, they cannot, they can grow bigger,
Right.
but they're still encapsulated.
Okay.
Okay, so they won't directly invade the tissue surrounding it. They'll press on it and push it out of the way. The cancer will actually grow into the surrounding tissues, and then the malignant ones can metastasize. The benign can't.
And can they tell it's a benign tumor if they actually see a capsule around it?
Sometimes they have a better idea that it just depends on.
Don't they
on
I
the
wanna say
screen.
they biopsy.
Well, they'll still biopsy, but by looking at a scan, sometimes they'll say, this looks
is-
malignant because of the way it looks, others, but they still need a piece of tissue
And
to
when they
know.
do the pathology,
Then they can tell.
but
Yeah.
what do they see different?
It's some of those things we talked about, what it looks like.
On the slides.
What it looks
The
like.
cells.
They'll look,
Is
they may
different?
do some of the testing for different mutations, they'll do things like that, but what it looks like, yeah, what the cells look like, how they act.
Okay.
And they can, like you said, they're benign, but they still could be harmful. I know we had, I can't remember who it was, but the tumor was growing, pressing, and it'd be painful.
Yeah.
So, good question. All right, the malignant tumors, oma to descanate tumor, carcin, epithelial tissue, and sarc, mesenchymal cells.
Mesenchymal.
I'm terrible. All right, staging. And there's different staging for different diseases. Process by which the location and extent of diseases are determined. Crucial, you want to definitely know the staging for your plan of treatment. You want to know what you're going to do. Helpful prognostic value, so the patient knows, you know what you're dealing with. Provides a common terminology for healthcare providers and researchers. There's a research out there, you want to know exactly what they have. Uses physical examination, imaging and lab results, pathology, cytology results, and tumor and molecular markers to assign appropriate stage. This is very important. Elements of staging system, multiple systems exist. Some systems are used for many types of cancer. Some systems are used for a particular type of cancer. So it all depends. Staging systems provide a systemic comparison of clinical criteria and are useful for evaluating patients for clinical trials. Elements of systems, size and number of primary tumors, how many tumors are there, as it spread, site of the primary tumor, lymph node involvement, are the lymph nodes involved, cell type, tumor grade, and metastatic status. I just had, my friend's niece just found out she had lymphoma, and they were checking, they go through multiple tests and staging for different things. Luckily, it just was in one spot. It was weird, it was actually in her cervical area that they found it. Yeah, she was very lucky. Types of tests used to determine stage: physical exam, look, listen, and feel. imaging studies, x-rays, CT scans, MRIs, PET scans. They can show location of the cancer, the size of it, the tumor, see if it's spread.